Today, we're going to be talking about what is depression? When is it depression? How do I know I'm not just having a bad day and it's more than that? That is a very common question, especially in today's world where there is so much being thrown at us from all aspects of life. My name is Monica McConkey, and I am a farm girl turned farm counselor. I grew up on a farm in northwestern Minnesota, and it's currently a fifth generation farm operated by my parents, my brother, and my son. So it's very purposeful for me to be able to be in a role of working with farmers and ranchers and their families every day, because it is like I'm talking to my family and I understand the issues and the stressors and the difficulty with operating an agricultural farmer ranch, an agricultural operation in today's world. So I'm very happy to be with you today. And for the next several minutes, we're going to talk about depression and what it is and what it means and what we can do about it. So first of all, let's talk about what does depression look like? This is a long list of symptoms, and I'm just going to hit on a few of them. So overwhelmingly, when we talk about depression, there is that feeling of just hopelessness, sadness, and heaviness. Like we feel like nothing in the world is going right for us. It's not going to start going right for us. We feel very heavy and tired and unmotivated. We may have thoughts of suicide where we're thinking of just ending our life to end the pain and end the suffering. We may find ourselves sleeping a lot more than normal. Or on the flip side, we may find ourselves being wide awake in the middle of the night, unable to sleep, but thinking over and over about all of the things that are going wrong in our life. We may notice a change in appetite, which could include either weight gain or weight loss, so an increased appetite or a decreased appetite. We may find a decrease in our functioning due to just really a lack of energy, where it's hard to get up and get out of bed in the morning and go out and milk those cows and do the chores or get into the shop and work on the equipment or get the kids off to school or go to our jobs, whatever it is. We may just really find ourselves struggling to make that happen. If you do work off the farm, you may notice an increase in calling in sick or using up your time off because you feel like you just don't have it in you to go, or you may be very emotional and feel like you can't handle leaving and going to work that day. You could notice that you have more difficulty making decisions, and you might find yourself doing menial tasks when there are things on the list that are really important to get to, and there's a time frame in which you need to get them done, but you just can't bring yourself to do it. So you're picking things that are easy, less stressful, kind of unimportant. And you're getting those things off the list, but not the high priority things. You might feel irritable toward the people around you. You might feel yourself shutting them off. You may find yourself snapping at them or being impatient with them in a way that you haven't been before. So all of those things can lead to being a bigger picture of depression. Typically, it's not just one thing, but it's a number of things that come together that really point out that you're struggling and need some help to get back on track. What are some risk factors? How do we end up in a position where we're even feeling depressed? Because things might be good and we're still feeling like we're in a low point. Commodity prices might be high, our yields might have been great, but we're still just in that unmotivated, low place that we can't seem to dig ourselves out of. So why does that happen? What are some risk factors? Number one is a family history of depression. If you know that you have parents or grandparents or aunts and uncles that have struggled with depression, possibly undiagnosed, but you know just from what you've seen in their functioning, you are definitely more apt to struggle with depression yourself. There is a strong genetic link to depression as well as other mental health issues. Major life changes can bring about depression. If you have had an illness or an accident or a divorce or even something that we typically see as a happy event, like the birth of a child, it can lead to depression. As can trauma. We know that trauma triggers things in our brains that disrupt certain chemical flow that can hinder us from feeling happiness. And so we feel like we're in a low place. Traumas can include past trauma, things like neglect or abuse as a child. Any life or death situation can lead to or be a risk factor for depression. General stress, and we all know life is stressful, farming is stressful. And when we are under stress for a period of time, it has an impact on our brain functioning, on our physical body systems and the way they function. And that impact can lead to ongoing depression. There are also certain physical illnesses or medications that can lead to depression. We know that low levels of iron and low levels of vitamin D and thyroid levels all can impact us feeling depressed. So what do we do if we're having some of these symptoms and we have possibly some risk factors? What do we do? And this is especially important because many times we don't feel like doing anything. It is hard when you're depressed to even pick up the phone and call somebody or make an appointment with your doctor. But it's important that we do it. Number one, talk with someone. When we are feeling depressed and isolated and like the weight of the world is on our shoulders, we typically feel like drawing inside of ourselves, when that is really the last thing we should be doing. So it's really important to talk to the people around us. Find a trusted person that you can share what you're feeling and what you're experiencing. Second, really consider that talking to someone, be a counselor. The best treatment for depression is a combination of counseling and medication. And not everybody is a fan of medication, and that's okay. But there is still so much usefulness in finding a counselor and talking to them because they will help you develop coping strategies so that when you are starting to feel depressed, you can immediately implement some things. You can know that I've got to change the way I'm thinking. I've got to change my physical body movement. I need to be around people. These are all things that are helpful. And I will also add that if you're hesitant to call a counselor or therapist or look at medication, a really good first step is getting a hold of your primary care provider. So your normal doctor, going in, meeting with them, letting them know that you're experiencing a low mood, feelings of hopelessness, and request that you do a full blood panel and have all of your labs done because sometimes there are very treatable physical causes to the depression or the low mood that we're experiencing. And then diet and exercise, so important. Look at how you're eating. Look at how much water you're drinking. Look at how much you are intentionally moving your body. I will also add that for those of us in the northern half of the United States, we are also more apt to experience seasonal affective disorder, which is a depression that's tied to a season. And for us, it normally is winter. So we have those decreased minutes of exposure to sunshine in the winter. It is cold, which drives us indoors. So we're not getting out and moving and getting exercise like maybe we normally would. So that's another thing to explore is if your low mood or depression is tied to a season, there are definitely things you can do to help alleviate those symptoms. At any time, you can feel free to reach out to me. This is my contact information, and I'd be happy to talk with you about what you're experiencing or what you're noticing in a friend or loved one who you may be thinking this might be depression. Um, I'm here to talk with you about that and process through that. I also want to share contact information for Karen Stallman with the Center for Rural Health and Social Service Development. And especially, I want to focus on the website given here on this slide, the siumed.org/farm. This website has a resource tab that has really great information, including counseling options. So if you or someone you know and care about is experiencing symptoms of depression, this is a resource for you to go to access help for them. I also want to, before we close out this webinar, talk for a moment about what to do if you're concerned that someone is thinking about suicide. This often goes with feelings of depression. So if you are hearing or sensing or seeing those signs of hopelessness that may be a red flag for you and may have you thinking, I'm worried that this person is thinking about suicide, it is very, very important that you ask them that question. Are you thinking about suicide? Are you thinking about killing yourself? And you can phrase it in a way that I am seeing you isolate more, or you seem to be really upset, or you've been missing a lot of work. You've been drinking way more than normal. I'm just wondering, are you thinking about suicide? And then depending on their answer to you, be prepared to access help. And there are resources on this website, but also a very quick resource is 988. 988 is the new national crisis and suicide hotline that will connect you with someone in your state or in your area. So if you're at a loss for any other resources, call 988. If you feel like the suicide attempt is imminent, calling 911 or transporting the person to your local emergency department are also strategies that can work to keep them safe. With that, I wish you all the best, and thank you for tuning in.